Good evening, everyone. I'm Dr. Jyotsna Rao, manager of Indian Care, and it's my absolute pleasure to welcome Dr. Ambereen Faroque from Center for Culture, Ethnicity and Health for our Chai Chat and Community episode this evening. Before I begin, I would like to acknowledge that I am joining from the Wurundjeri and the Bunurong land of the Wurundjeri and the Bunurong people of the Kulin Nation. I pay my respect to their elders past, present, and emerging. So, Ambreen, just tell us something about yourself and what you're doing at the center.
Thank you so much for having me on the show. I'm very excited to be here and to be speaking with you about our topic this evening. But I've actually joined the Centre for Culture, Ethnicity and Health about 5 to 6 months ago to work on a very special project of an emerging problem in about 12 multicultural communities that were affected by the first wave really of COVID-19 in the very first stages when it was starting to affect Melbourne. And the project is to help these communities raise the awareness of long COVID, which is now the follow-up illness after COVID-19. So we're working across 12 communities specifically, and that's my role to reach out to community workers, community health workers and volunteers, anyone who can help us get that information out to their communities, and that's what I've been doing. So I'm very pleased to be able to reach out today to your community and all your listeners. So thank you for having me.
Pleasure. That's really fascinating, huh? Long COVID. What is long COVID, Ambreen?
It's interesting because we when COVID-19 started to spread across the globe, and we saw it in large numbers in places like Europe and the US. Well, we were noticing, I guess, that at some point people were recovering, but some people were not getting better. So weeks would pass, and usually we expect the majority of people, if nothing else happens, to recover from COVID-19 within sort of 4 weeks. But what we were actually seeing was that in some people, they wouldn't recover. They would start to remain unwell. They would develop new problems, and their problems would come and go and be of various severity. And so people started to call this long COVID. And that's really what the disease is. It's the disease that happens really after COVID-19 itself has burnt out in the body, but yet symptoms and signs and problems remain in a person, and that's long COVID. So we can talk a little bit more about how it feels for people, but yeah, that's essentially what it is.
Yeah, I think it would be very helpful if you could actually explain what signs are and what symptoms are. I think it's very confusing, and we tend to use them both together when we speak. So if you could just elaborate on that.
Sure. So if we really want to understand something like long COVID, we need to understand signs and symptoms. You very correctly identified that, because it is essentially a condition or a disease that is made up of lots and lots of signs and symptoms together. And that's why it's a syndrome. And it does have other names, and we'll talk about that in a minute. But symptoms are things that people feel within themselves when they're unwell. So anything that a person feels is not quite right. So we're talking about things like cough, headache, dizziness, chest pain, back pain, joint aches, flashing lights in the eyes. All those things are things people experience, and so they're symptoms. And really, there is a wide range of symptoms associated with COVID-19 and long COVID. So we will talk about those. But the other thing that you also talked about was the signs. So what are signs? Signs are a little bit different from symptoms. They're not necessarily things that we experience within ourselves when we're feeling ill, but there's something certainly that the doctor or a health professional can check and measure on you. And it's things doctors love to check are, pulse rate, blood pressure, temperature. So these are not things that I or you might notice changing in our own bodies. We might not notice there's any difference if we have a change in our blood pressure, but certainly a doctor can measure it and monitor it and check on it. And those are signs that the doctor looks for. And keeps an eye on. And so essentially COVID-19 is made up of a whole lot of signs and symptoms that when they occur together, that becomes long COVID. And that's why we sort of need to understand what those two things are.
Right. So, with the are there any? So I know that COVID, we've read it in media. We know it from the Department of Health and all the present pressers that we attend. Is cough, soreness in the throat, loss of smell, loss of taste. Any itchiness, go get tested. That's what we are supposed to do. Is there any overlap of these symptoms with long COVID, or does long COVID has an entirely different one? Like, I have read that fatigue is very common with long COVID.
Yeah.
So, in fact, this evening somebody was telling me that a 12-year-old in interstate got COVID and cannot do more than 2 hours of school, and that child got COVID 8 months ago. Is that something that is long COVID, and can you see it in children as well?
Yeah, so that's what you're describing is absolutely right. That's certainly how long COVID looks, and it certainly can be a condition that you see in children, and that's really what is the worry for us as health professionals, is that you don't want to see children with a condition like that, which is very hard to determine how long it would last, what impact it might have on them, and what long-term impact it might have on them. Certainly in children, it's very, very worrying. But you talked about are the symptoms, are the feelings you get when you're unwell different from COVID-19? And they certainly are. So COVID-19 in essence is a respiratory illness. Yes, you'll get a few other things wrong with you, but just like you said, we all are sort of trained now to understand what are the symptoms of COVID-19. And I myself the other day had a few of those symptoms. I went out for the first time after lockdown, went and visited family and friends, and a few days later I started having a bit of a sore throat, a cough, headache, just a few aches and pains, feeling unwell. I mean, that's typically the symptoms of COVID-19, but thankfully I went and got tested and it wasn't that, it was some other virus. So I felt very relieved, even though I still wasn't feeling healthy. I was feeling at least relieved that it wasn't COVID-19. So that's essentially what we're looking at. We're looking at a respiratory illness for COVID-19. And that is essentially what it is. You can get some joint aches. You can get some other feelings, general feelings of just being unwell. You can get fatigue, all those sort of things that go along with viral illness. But long COVID starts to become something very different from that, where the symptoms, the feelings of being unwell are not just in the lungs and to do with the breathing. It's starting to affect the whole body now. And that's where it can become a worry, because we see every system in the body affected and symptoms related to every symptom. So we can start with the brain. We're seeing people affected by having memory issues, anxiety, depression, problems with their cognition, lack of motivation, and things along those lines. And that's to do with the brain. And that's only just some of them. We're starting to see pain. Pain is a very common symptom, but not just in the chest. We're seeing people with back pain, joint pain, kidney pain, all sorts of parts of the body can be affected by pain. We're also seeing skin changes. We're seeing muscle and joint aches, which is very common. But as you mentioned, in that young the young girl that you talked about that was still unwell 8 or 9 months later, we're seeing a lot of fatigue. And fatigue is not just your regular tiredness. It's not just feeling a little bit like, oh, I can't get up today and do that. It's actually this profound and prolonged fatigue that is really, really hard for people to overcome at the time when they're hit by that. They literally can't do anything. And so I think that's something that I would really like to, communicate to your viewers, that if you know someone who has long COVID, this is actually something that really affects them, and it can be very debilitating. Yeah.
Yeah, that's certainly a worry, isn't it? So we have a question from Chris. Can the mRNA vaccine possibly interfere with somebody's genetic structure? Can this be a long-term effect of the vaccines? What do you think, Ambreen?
Yeah, well, I can definitely tell Chris that there is no evidence of that, as far as we know. A lot of research has been done on vaccines. A lot of research, a lot of money has been spent looking at how they affect people, and what impact they have. And I can definitely tell you that is certainly not one of the issues to do with vaccines. And if it was, I certainly wouldn't have taken it myself. I certainly wouldn't have recommended it to my family and my kids. My older parents, the reason I feel comfortable every day that they're going out and about is because they've been vaccinated. And that's the only reason that I feel happy that they can do that. So, no, that's definitely not an issue.
Excellent. So the other question, just as a segue from that vaccination question, is does being vaccinated help with long COVID, or is that still very early to say?
I think the results are definitely heading towards that direction. I mean, we can definitively say that the vaccination for COVID-19 decreases the risk of a long COVID significantly. Um, and I think that's one of the things I really want to communicate to your listeners. Um, I think out there in the community, there can be sometimes this idea, especially amongst fit, healthy young people, that COVID-19 is just a respiratory illness. I'm healthy, I'm young, I'm fit. If I get it, I'll be over it in 2-3 weeks. I'll be back to normal, and then I'll be immune after that. I'll be fine. But if they actually had this understanding, that there could be this long-term impact. There could be months later that they could be suffering from something like long COVID, then I think people would be a lot more keen to perhaps step forward and get the vaccination. And it's really important that people understand that vaccination is not just for COVID-19, but it's also for long COVID, because we don't want people suffering months down the track if it could have been prevented by taking a vaccine, or their risk significantly reduced. And I think that's what the research is showing, that risk of long COVID is significantly reduced if you're vaccinated. And I'll tell you another thing is that they're now starting to see that in people with long COVID symptoms that are going on for months and months, sometimes if you vaccinate them, they start to improve, their symptoms start to improve. And that's just some very early research that we're also seeing. So vaccination has a double effect, I guess. It's almost, I guess, I don't want to use the word treatment, but it's used to start to improve the symptoms of long COVID.
Oh, that's certainly reassuring to hear. So please get vaccinated.
Yeah,
The next,
definitely do.
yeah. Sometimes I feel we should literally have a banner everywhere saying get vaccinated. I think we've done really well with the vaccination, certainly a lot higher than many other parts of the world. So I'm just curious to know. I mean, there was a recent paper that came out saying South Asians are genetically more at risk for respiratory, um, illnesses. And just from that, I'm very curious to know if you have any sort of numbers to share with us on how much, how many get affected percentage wise by long COVID, and is there, very nice question, Chris, can long COVID symptoms differ among different ethnicities?
Yeah. So Chris is actually talking about something very important, and that is not only do they differ amongst ethnicities, I'm not sure about that answer, but they also differ amongst people. Um, and, you know, you may have one person who has some completely different symptoms from another person. And I'll tell you, a lot of the articles I've read, there's one very specific one that talks about how many symptoms all up can people with long COVID have. And what they did is, I think in the UK, they asked about 2,000 people to write down all the problems they were having, these people who had long COVID. And when they tabulated all those results, they found that there were about 205 separate symptoms to do with long COVID, separate feelings that people were experiencing in their own health, and that was making them feel unwell. So 205 separate things. It doesn't mean everybody has 205. It just means that somebody that I might be looking at with long COVID might be very different from the next person that I'm looking at. So one person might have a lot of headache, a lot of fatigue, anxiety, depression, and joint pains, and the next person might be having chest pains, palpitations, which is unusual beats of the heart, backache, a bowel instability, with constipation or diarrhea. So those are all symptoms that I'm describing of long COVID, but in two different people, they might be very, very different. So I think that's something we need to understand. What someone, your relative, if they've got a problem overseas, they might tell you they've got some problems, and yet you might meet someone here and they've got completely different problems. So I think that's it's very unique almost to that person. And the average person who has long COVID has about 10 to 15 symptoms. And I can tell you, when I first read that in an article, I actually had to read the article over a few times. I'm thinking, is that really possible? Is really someone coming in complaining of 10 to 15 independently different problems with their health after COVID-19? And yes, it's very much the case. So.
Yeah, interesting, isn't it? I can see so many PhD theses happening after this long COVID. So, just to answer that question, Chris, does it differ among different ethnicities? I think we can safely say it is still too early to say that. However, it can be manifest as different symptoms in different people depending on how they react to the COVID thing.
Mm.
So, the next question is, can the vaccine offer protection against long COVID? And that's coming from Sophie. So, I think yes, Ambreen, I think you might have to just repeat that again.
Yeah, so thanks for the question, Sophie. Yeah, so we talked about how a vaccine is our only preventative at the moment for long COVID, because we don't have effective treatments for long COVID at the moment. When someone gets sick, all we can offer them is some supportive treatment. So if they've got a very specific problem, we can help support them, get them over that problem, or help them get them through until they start to recover. But we can't actually cure long COVID. So the best way for people, as you've mentioned, is the vaccine. And the vaccine definitely will decrease your risk of long COVID considerably. And at the moment, a lot of research is being done into that. And so I'm sure as time goes on, we'll get very specific numbers as well, and percentages as to how it affects long COVID.
Thank you. So there's another question, that are certain age groups more likely to get long COVID? And I think while we are answering this one, Ambreen, could you also tell about the percentage that could possibly get, if there's any research or any definitive answer around that? Thank you.
So at the moment, a very conservative estimate is that out of every 10 people who get COVID-19, 3 of them will go on to develop long COVID. So that means after 4 weeks, after their infection, they're still having symptoms. So 3 in 10 people, after they have the COVID-19 infection, at 4 weeks and onwards, they will still be having problems. So that's about the figure that we're looking at. And it's quite a considerable amount of people if you think that this is a global condition. So because places like Europe had quite high caseload prior to people being vaccinated. We saw in a place like England, we're having almost 1 million people with long COVID, and that's a significant burden for their health system. Not just individuals and how they're feeling, but how the health system might manage and take care of these people. So that's really a big problem.
It most certainly is. So that, I guess the next question that would occur to me would be that, yeah, Ambreen, Sophie, are certain age groups more likely to get long COVID? Would you say that children or elderly or young women or men, who do you think, from what you know, is more likely to get it, or do we not know at all?
So there is actually an answer to that. But when people ask me that question, I like not to give the answer. And I'll tell you why. Because we're all at risk. For an individual, there's no good in me saying, well, it affects more middle-aged women. Because then that might give everybody else a sense that, oh, well, we'll be fine because it won't affect us. If I'm a young, healthy man, it won't affect me. Or if I'm a middle-aged person, it won't affect me. But the truth is that at an individual level, we all have to protect ourselves in the best possible way. And I think that's what I really want to communicate with your audience, that no one is really immune from it. If I could sit here and predict, looking at a whole group of people, perhaps in your audience, and say, look, you guys, you're all safe. You're the ones at risk, and those people have less risk. I can't really do that. And I think that is not only the mystery to do with long COVID, but also to do with COVID itself. I mean, and your listeners would have experienced this in their own personal, with people that they know. Some people that they're very surprised got sick and with COVID-19, and some got, who were perhaps they thought would get very sick, didn't get sick. So I think there is a bit of a mystery when it comes to who might be affected and how badly they might be affected. So we're looking at people, young people, older people. Yes, they have different risk, but anybody can be a target, and including children. And I think that's something that's really important, because we're getting to the stage now that we have to think about our kids, about getting them vaccinated. And I think the other thing we should really understand is children are not immune. They can also get long COVID. And I've got this really excellent video from children who actually were affected in the UK, and they have a website called Long COVID Kids, and they talk about their experiences. And some of them, 200 plus days later, still quite debilitated by symptoms. And so no one is immune. And I think, telling certain groups, oh, you're young, you're healthy, you've never had any other illness, you'll be fine, is completely misleading, I think. Yes, they might be at less risk, but it doesn't mean that they're at no risk. And I think that's really important to know.
Yeah, can I also just emphasize that it is important to get vaccinated? To everyone listening, please, if you haven't, book your appointment and get vaccinated. If you need assistance making that appointment, please call Indian Care. You can find our number on our website, and we'll help you, assist you with that. So when you kept saying the thing about the healthy person, I was reading an article in The Guardian today about this person who was a bodybuilder, and he participated in a lot of bodybuilding shows, and he won a lot of awards. But when he got COVID, unfortunately, he didn't make it. And when he passed away, when they asked the NHS, asked the family to come
Mm.
in, even the consultant, the specialist, the nursing staff, everybody was in tears, because it was such an unnecessary loss of life, because he
Mm.
didn't get vaccinated, and his family was vaccinated but he wasn't. It's
Mm.
interesting. So the next question that Chris is asking, which is, I think, a brilliant question: do you have any numbers or data to show if there's any research made on the mutation rate of this virus?
Oh, well, that's an interesting one. I don't quite know how to answer that. I mean, the mutation rate, it will continue to mutate. I don't know the exact figures of how that is calculated. Do you have any experience with that, Trista? Do
No,
you?
I no,
Um,
I didn't do virology. I did physiology. But the reason I think that we can't predict, although there is some research coming out of other countries, particularly South Africa, on this. The way I look at it, if there is a host, it will mutate because that's what
mm,
viruses do. They live inside a capsid outside until they find a host to infect. So that's the reason why cutting that transmission route is so important. And as many hosts they get, that many mutations will happen. This is an
absolutely.
mRNA virus, which is highly unstable. Everyone knows
Mm,
that. So, great
yeah.
question, though, Chris. I mean, I can tell you 10 years down the line, we'll have so many answers that we don't now.
Yeah, it's certainly an area that a lot of people are going to be looking into and are looking into. So it's very interesting.
Yeah.
Um, and you're right. I mean, so true about cutting off the opportunity of the virus to mutate by not giving it large populations that are unvaccinated, because the virus wants a body that it can freely grow in and freely change and become stronger in. And I think if we prevent it having lots of those people where they're unvaccinated and the virus has free reign, then we can certainly stop some of those mutations from.
Yeah,
Mm.
which leads us to a very nice topic. What can we do to protect ourselves from and our community from long COVID,
Yeah.
Ambreen?
Well, I think one thing we really need to do in Australia and certainly in Victoria is to improve the awareness of long COVID, and I think that's really important for two reasons. It's important because um, not only for those who are suffering from long COVID, and we're talking specifically about people who came through those first and second lockdowns and those first waves of the COVID-19 illness in Victoria, who now may be suffering from long COVID. So if we get the message out there that this is a condition, this is something you could be affected by, seek some help, go and talk to your GP. If there's still symptoms in your body months later that you're not sure why you're like that or why you're still not quite back to your normal self, then get those answers, and the GP is the best place. So we need to raise that awareness, not only for people who are suffering, but also for those who are not suffering but may not understand what these people are going through in the community, and these people need support. So if I was going through a long-term illness like that, where every day I would wake up, I wouldn't be quite sure if I'd have very bad fatigue, very bad headache, chest pain, problems with my heart, joint pains, not having energy. If that was happening to me, I would need support of my family and friends and my community. And people are not going to be able to support you if they don't understand what you're going through. They don't understand it's a real illness and it's an ongoing problem, and it's a chronic problem. So I think those two things we really need to raise awareness for those two reasons. And like I said, if you feel you have an issue with long COVID, then certainly your GP is the first person you need to approach.
Hmm. So I've just been thinking about the symptoms and signs that you were talking about previously earlier, and I'm just wondering. It seems to me that it mimics a lot of other conditions as well. Like I know that with chronic fatigue syndrome, particularly as well as when a woman is entering menopause, joint aches, headache, lack of sleep, brain fog. These are very common things that we hear women complaining about. What are your thoughts around that?
Yeah, so that's completely fascinating that we are seeing it mimic other conditions, and I think that's really important, especially for those people who um, may not have understood that they had COVID in the first place, COVID-19 in the first place. So they may not know that the things that they've got are issues around to do with long COVID and exactly what you've described. So they might be thinking, oh, this is just my menopause because I'm a certain age or whatever. And these symptoms that I'm feeling perhaps connected to that, or perhaps connected to arthritis because now I'm older, maybe that's what I've got. Or, they may be, having depression and not know why that's persisting. Or, other things. I mean, there is, some of the symptoms of long COVID are very similar to what diabetics might feel, dizziness, dry mouth, frequent urination, all sorts of things like that. So it is a great mimic. So you've pointed that out completely correctly. So people have to be aware. Could it be their underlying condition? Because I know there are a lot of people there with different underlying conditions in their health, or is it something new? But certainly, I think they need to have a degree of suspicion, especially if they've had the infection of COVID-19 in the past. Is this really my health problem, or is it a new problem like long COVID?
Yeah, good point. So does when people test, say for example, somebody gets a cold during long COVID, would they test positive for the COVID test?
No, so I think that's also something that has to be really made clear to everybody. The COVID-19 infection is essentially burnt out. So at 4 weeks, that infection is finished. The acute infection from COVID-19 is gone, and from 4 weeks onwards, we're starting to see health problems in people, but no positive test. So, and I think, and it's very important for others to know that, because there is still stigma associated with being positive for COVID-19. And if people in your community see you and still feel, oh, look, they've still got joint pains, they've still got bad headache, coughing, then it needs to be made clear to them this is not COVID-19 anymore. That infection is finished, and now we're seeing symptoms in this person of long COVID. And they're not infectious. They're not going to pass it on to anybody else, but they're certainly, you can see them looking unwell and suffering from those symptoms. So I think that's just a really important point.
Yeah. Presumably they don't need to isolate then if it is long COVID, yeah?
No.
Yeah, but the flip side is they can't go to work because it's a debilitating condition.
Yeah, and I think that's the really hard thing, and you'll see that it does significantly impact a person's ability to work, to interact with social interactions, to even seek care from their health professional. I mean, a lot of people don't have a lot of energy or a lot of motivation even to do that. So I think that's always a struggle. So a lot of different impacts, not just work, but other things as well. So
Yeah. Anyway, so I think there's a question from Chris on that awareness bit. So there are two questions. One is, how do we raise awareness of getting vaccinated in rural parts of most of Southeast Asia? And then we'll take the next question. And I think this was something even I was interested in knowing. Like, I know that we found out through LinkedIn when Sophie posted that, long COVID conversations were going to be happening, and we wanted our team at Indian Care to learn, because we need to tell the community when we are talking to them. I would be very keen to know, how can we help you spread this message of long COVID wider? And also, what other strategies would you like help with on raising, because this is primary prevention. Essentially, we are telling them get vaccinated, otherwise there is this condition. So how
sure.
could we
So
help you further, Ambreen?
yeah, so I mean, something that part of the initiative that I'm working with is that we have produced translations on our health translations webpage on the CEH site, and those translations, like I said, we're talking about 12 different languages, and specifically for the Indian community, it has been translated into Hindi and Punjabi, and I think that's a very it's the government fact sheet, and it's a very good informative source of information, and not only for people who may who may need information in another language, but also if you wanted to take the English language fact sheet to your doctor, because sometimes I think the other side is that maybe doctors may not be aware that they should be looking for this condition. We're trying to raise awareness of that amongst health professionals, but that also could be a concern. So just taking that along, having people read it not only in their own language, but just taking the fact sheet to the doctor and saying, hey, I had COVID in, last year. Could I be having this problem now? And sometimes that can be of help. But, certainly in rural areas, I think having translated information is very important. But I think also, just like you said, having conversations like this to raise awareness. And I think also people should never underestimate the personal conversation. So all your listeners here who are listening to us talk and listening to all your other wonderful programs that you've had on your station, can go and have that personal conversation with their friend, their colleague, their relative, even if it's someone in another country. Really important to do that, so that personal conversation should never underestimate what impact it has on another person. And that's why I love to tell people, I've got parents, they're elderly, I've given them the vaccine. Would I do that if I wasn't 100% sure that the vaccine wasn't safe and beneficial? No, I wouldn't. So I think just having that discussion with another person in your family or in your circle is so important.
Yeah, true that. Very true. So, Lily and Chris are asking this question on, do you reckon that we are on our way to get COVID vaccine shots every year, just like flu shots? Brilliant question, particularly now with the announcement that we need booster.
Yeah.
What are your thoughts around that?
Yeah, I think that's definitely the way we're going. And very sort of insightful observation that, yes, it is looking like every year we might be in that position. And certainly if we've got a virus, like you were saying, Joyce, that mutates, that produces a new variant, then you would want to be protected from that. And they will continue to develop vaccines that are sort of helping you protect you against the new variants that are coming out. So I think that is certainly our near future. That's what we're looking at. What the long term holds, I don't know.
Yeah,
It's too hard to say. Yeah.
yeah, true. Yeah. Anyway, so I was just going to ask you something about long COVID video. Is it possible for you to give us that link? Then we can put it on our Facebook, the children's one that you were
Yes,
talking about.
certainly.
Then,
Yeah.
yeah, thank
Yeah, I
you.
can definitely send you all the links from my workshop, and we'll be very happy for you to put them up. And like you said, the COVID one, I think for children is very important, because that's the question that we're going to tackle now as parents. Should my child have the vaccine? When is it right? Or are they at no risk? Or are they at some risk? Or what should we do? So I think, understanding that kids can get long COVID. Of course, it's less chance than adults, but still there. I wouldn't want to risk my child getting it. That's for sure.
Well, this is true, and I think the primary schools are now becoming, those settings are more vulnerable because the children aren't vaccinated. I know a few parents who have constantly been getting, needing that COVID testing and needing to isolate until the result comes through, and it's incredibly stressful, particularly when you can't go. And if it happens on a Friday night and you don't have food at home, these are all very practical problems that we need to deal with, and not everyone has a big family that you just pick up the phone and say, well, I need this delivered, can you do that?
Mm.
So I guess, yeah. Was there anything else that you would like to share with us about long COVID?
Um, I think what I really wanted to say was sort of covered. I mean, we've talked a lot about the vaccine and how that's important. We've talked about how anyone can sort of get it, and I think that's really important for people not to feel that somehow, for some reason, they're protected from something like long COVID. I think that's really important for people to know. I really would like people to know it is a different condition from COVID-19. Long COVID is a separate and completely different condition and needs different management. and it's not an infectious condition. So a person who months later is still unwell is not infectious. So I think that's really important. Um, so I think that really sort of covers things. Have you got any further questions for me?
I think there's just one coming just now. Some people are hesitant to get vaccinated due to religious beliefs. How can we make them understand about the importance of the vaccine? So I
Yeah,
think,
that's a bit,
yeah,
yeah.
there are two parts to this actually, don't you think, Ambreen? One is how is that vaccine made? And then the importance of vaccine, which I think you've really covered quite comprehensively, that you need to get vaccinated. It would be very nice if you could cover the bit about how vaccines are made and probably, dispel that whole notion about what religion is associated with that process.
Yeah. So I think one of the things I'd like to tell people when they ask me questions based on religious belief is that in every religion there are people, scholars, and people who make those judgments or those decrees about something. And certainly for my own faith, I know that those judgments have been made about the vaccine being safe and perfectly normal therapy and religiously fine for people of my own faith. Um, so I think those determinations are made by people with a lot of experience, not only in the legislation to do with their faith and how that might impact people, but also to do with the medical side of the vaccine and its components and how it was put together and what was used and how it was used. So when that judgment is made by someone with a lot more qualifications than me, a lot more understanding than me, then I would tend to say that's where I put my would put my sort of assurance that that's okay. Someone's thought about it. Someone's examined those issues, and they're fine, and they've made a judgment. And at the moment, I know for Muslims that's certainly very very clear that it is certainly fine for all vaccines, and there are no issues around it. And I'm sure for other faith groups that would be a similar thing, that there are bodies that have determined that it's okay. And when those judgments are made, I think it's really difficult for a doctor, an individual, or someone to say, well, no, I think it was like that, or it was like this, or how can you say that, because somebody has examined it, a group, a body of people with a lot of qualifications, a lot of understanding of their issues in a lot of depth, have made those judgments. And I think that's sort of sometimes the best way to look at something. I mean, there are a lot of things in our life we accept and we just move forward, and we don't think about them in a lot of detail. We don't tend to do our own research, and yet we move along with them, especially to do with our own health. And vaccines are no different. We need to find the people who have the best knowledge. What determinations have they made? Can we trust them? Yes. If we say yes, then we should just move forward and accept the vaccines for what they are. Do you think that
Very.
answers your question, or do you want
No,
a
I
bit
think
more of
it
a
does.
technical?
No, I think it does. I mean, without getting into the technicalities of how the vaccines are made, with the human cell lines that they're propagated, with the serum that is used, etc. I think you've done a great job answering that one. So the final question for tonight is from Chris. Is there a possibility that the mutants become resistant to the mRNA vaccine and prevent them from producing antibodies?
I totally believe that it could be a possibility. Yes. And is that your understanding too, that that's how mutations can occur? They can be quite different from the parent, um, at least certainly down the track. Mutants may continue to differ from the original vaccine that we have. Um,
Yes.
so we, so that idea of being vaccinated annually with a new sort of update to the vaccine will be important in the future.
Yes, totally.
Yeah.
I totally think so. So it will be interesting. Um, these questions will keep coming. I think it's good to then put CH in the chat, but this is the last question for tonight. Chris asked there are 200 different effects of long COVID. Is it a possibility in the future that the virus could affect ability to get pregnant?
Um, you know what? With 200 separate symptoms, I'm not going to say no to that. I mean, it certainly might. Um, I'd like to think that it wouldn't permanently affect it in the same way that other parts of, other symptoms are not necessarily permanent. We're starting to see people, they do recover. So I'm hoping that the body also, if that is an impact, that can certainly, the body can recover from that. And I think that's what we are seeing with long COVID patients is they do start to recover, but it is very slow, and their lives can be impacted for many months, if not years. But we don't know the long-term impact. So yes, that certainly could be one. It certainly could be a long-term impact. Let's hope it's not.
And on that note, thank you very much for your time. It's been an absolute pleasure to learn about long COVID, particularly because it has, flow on effects on people's health and the burden on public health as well. So thank you very much for joining us this evening, and we hope to listen to you once more. Thank you.
Thank you. My absolute pleasure. Thank you.